stabilized, that all the electricity is hooked up, the generators are properly working. We bring all of our own fuel to run the generators. The only thing we ask of a location is a direct tap to their water line. Joe and Richard will make sure that all the water lines are hooked up properly. Day 2, the staff comes together and they ensure that the trailers are properly stocked and ready to go. Usually this starts off by Joe and Richard and Epi going through all the different trailers, making sure all the power, water, and lights are all properly working. They'll restock all of the supplies in all the trailers to ensure that every trailer is its own functioning, self-sustaining clinic. They make sure that all the supplies are stocked in every trailer to make it a more efficient process of handling all of the everyday dental needs. All the essentials. They make sure that all the accessory equipment is also in good working order. The X-ray units and the X-ray developers. Epi and Richard are solely responsible for our IMS and supply trailer. All the trailers are properly cleaned from top to bottom.
Service learning implies that we're doing something to kind of introduce students who might not even be interested in it to learn about it.
From first year, USC was teaching us how important it is to be involved in the community and to help out.
Having been exposed to the different elements of community service while at school, it makes the awareness in that student, so when they do leave and graduate and go back to their respective communities, they know that there is a need in the community. The students will come together on a Friday and we'll go through our morning meeting bright and early. We talk about what our expectations of the day are. First off, students will check in with Richard and Epi at the IMS trailer. Secondly, they'll work as a team to properly unload all the soft ops. Now these soft ops are portable chairs fully utilized to perform dentistry. 24 portable soft ops are set up by the students in the auditorium, ensuring all water lines, all electricity, compressors, suction, you name it, is working.
This all started more than 30 years ago when Charlie Goldstein decided he wanted to take his dentistry a step further to help others, and it continues to blossom today.
It's my passion. It's my passion. You know, I mean, the kids I work with, the faculty I work with, all these patients, it's just wonderful. I look forward to every day that I go to work.
The university takes ownership for this underserved community here and has decided, well, let's do something about it. All 120 patients are expected to check in Friday morning, bright and early. We start at 8 a.m. Friday's a big day of oral diagnosis, evaluation, and x-rays. With all this data collected, the students are able to come together to formulate treatment plans.
We do a full diagnosis, head and neck exam, medical history, and treatment planning, and then over the course of 7 days we complete basically full mouth rehab for most of them.
For the community to have resources, or for us to identify those resources that many times are already there, can help the migrant children and their families receive services that they need in the area of health.
First day is real easy. We take their x-rays, we go through some oral evaluations, we count their teeth, and we show them what our mirror, our explorers, what our instruments will do, and what they will do for us to ensure that we're properly treating them.
What we really want to do is to be able to get clinic time for these kids.
We provide treatment over 6-7 days, and we could easily stay in one area for a year and probably not run out of care.
They can learn how to do dentistry at the dental school, but they don't meet these different cultures that they normally would not have any contact with. It's good for their soul, you might say.
The kids have already gone through the very painful process of having cavities in their teeth and have been distracted and unable to even attend school And that's a big priority for their parents, and we help in that we can take away at least that barrier for those kids.
When the children have to miss school because they're sick or in pain, that needs to be addressed.
The students will come together to formulate treatment plans from the x-rays and the oral evaluations. Upon formulating a treatment plan, the students are able to determine how many appointments one patient will need to finish all of their care throughout the week.
Under the No Child Left Behind Act, local school districts are the agencies where services will be provided for migrant students that are in the migrant program, and each agency has to be able to demonstrate effectiveness in terms of services offered.
Usually these kids don't qualify for such services like Medi-Cal or Healthy Families. We come in to do a week-long clinic and provide free dental care at no cost to them. These are the kind of patients that have never been to the dentist before, so it's really crucial that their first visit is a good one. Working with volunteer faculty allows students the chance and opportunity to work with other doctors aside from the clinical faculty at school. All of our faculty that come on Saturdays are part-time volunteer faculty. They have a great history themselves with the mobile clinic, having been students once with the mobile clinic. All 120 patients will come back Saturday for the first treatment day.
I'd heard a lot about mobile clinic before as I started dental school, and I thought it was a pretty good place to learn and get good experience.
Every year we have seniors that volunteer to go to every clinic. We depend on them. They run the clinic. We see that they're doing things right as far as the dental part, but we couldn't do it without them.
The large majority of migrant children have no health insurance and only minimal access to free state services.
The most important thing for me is that I'm obligated to give back what I have. I started working with the mobile clinic when I was a dental student. Quite frankly, the reason I started was I was drawn to Dr. Goldstein. He was a good mentor for me, and the program he's developed is vital for the communities that it serves.
I love this program. I mean, we're taking care of kids that never would see a dentist.
The Migrant Education State Office provides guidance and general oversight, but it's the individual regions that decide how best to implement their programs and services.
The student dentists value their learning experience from these alumni. The alumni will show them proper chairside manners with the patient. They stress the importance of using the rubber dam and how comfortable it is for a child that a rubber dam is utilized. The opportunity for the student to learn quadrant dentistry is made available by these Saturday clinics. At school, we see a lot of adult mouths, so this really gives the opportunity for the student to see a mixed dentition, baby teeth and adult teeth at the same time.
You don't feel anything, huh? That's great.
USC takes a lot of time in educating the students. They get a good feeling about going to the dentist and see it as a good thing instead of something to be afraid of.
The core philosophy is to basically do the best work that you can and do no harm. Everything is geared towards doing a service for the community. It's not just how your smile looks, it's your total oral health.
I think students have an opportunity to see what they can contribute, not just as a means for income, but also to see that there are some tremendous needs and that there's a significant role that a dentist can play.
The School of Dentistry's classrooms and clinics have state-of-the-art equipment and technology. However, in order to sustain and increase the impact and size of the community programs, the School of Dentistry has sought support from the incredible partnerships USC has created with local communities, government agencies, private foundations, service clubs, and corporations. These partners are responsible for sustaining every outreach program USC offers.
Our students, our faculty, our staff are engaged both in the future of Southern California, state of California, the western part of the United States. Essentially, we have faculty and students influencing all of the United States and beyond. The USC School of Dentistry exists to improve the oral health of all people. That's our mission.